initiative, Raman. Excellent solutions. I think just to highlight what Arvind said, uh, point of care needn't have to be for primary care. It could be as a point of service, and all the solutions that you presented today are, are excellent solutions. And the rigor with which you've gone about doing the validations and you continue to do your validations, I think is a story that we need to tell and share with other startups as well. One of the things that we as a research institute also work closely is to ensure that when we work with startups, that solutions ultimately meet the accuracy and the rigor of repeatability, uh, which then becomes easy when you file for your compliances, whether it's the FDA or other compliances. So I think, having said that, you'll have demonstrated some excellent work here. I was particularly impressed with the publications, the 45 peer-reviewed publications that Remit shared. I think that's the way to go for most startups to really capture uh, your evidence and make sure that, because AI today, ultimately needs that kind of evidence. Some of these devices are excellent. You've demonstrated at the point of care how AI could be used to make help with decisions or decision support. And you've also reduced the efforts in the sense it doesn't have to be a doctor or a general practitioner at the point of care. It is it is nurses in some cases or healthcare workers in other cases who can use such devices and assist in this whole care ecosystem. So in terms of relevance, I think all of you have, attempted to solve problems which are highly relevant in our population, especially in resource constrained settings. And what I found is a common thread across all these devices is, which Santanu put up in his earlier slide, that affordable component is definitely seen across these solutions. And whether it's AlveoFit who's looking at COPD and not just using a device, all of you have end-to-end solutions. It's not just say giving the patient a device or giving the healthcare provider a device, but also supporting them with end-to-end solutions, which is, I think, an important thought process in providing a healthcare service solution rather than just providing them with diagnostic. I think this is very exciting. Uh, although we've heard about the different advantages and we're all aware of the advantages of point of care screening. Uh, for startups who are getting into the system, I think it's important to actually identify needs. Like you all have done, the three groups of the startups here have done, really been careful about doing a needs finding. I think that's another story to share with budding startups, to really do a needs finding at the grassroots level, talking to providers, talking to other healthcare stakeholders, including patients sometimes, to understand what are the actual needs. Because once you go out there and when you want to scale, it really is important for startups to understand how can such uh, a solution be adopted. If you're talking to governments or you're talking to NGOs or other stakeholders in the healthcare ecosystem, it's important for them to understand how easy it will be to adopt. And that's where the needs finding is a very important step. And to that effect, in our recent vision document with the government of Karnataka, we had suggested creating what are called digital health innovation hubs. This is for primary care, but you're all aware of the health and wellness clinics, but these can ideally become, some of them can become healthcare innovation hubs, where such solutions that you have can be piloted with existing healthcare ecosystems. So I would really recommend all of you all to work towards that and kind of try and focus on improving our health and wellness clinics, which have been created in our country, and of course work with other care providers to really, take healthcare to the next level for India. Thank you so much, and really